wellness revolution starts now.
Welcome to the program. My name is Bryana Gregory, pharmacist and physician liaison with Physician's Preference Pharmacy. And today we're going to have a conversation about Methylene Blue, which is an absolute rock star compound that we make right here on site at Physician's Preference Pharmacy. So I want to address today in kind of a question and answer format some of the questions that we get about this compound to shed some light on how it works and what it can do for you.
Okay, so I'm going to start the questions. So for Methylene Blue, can you tell us what is Methylene Blue?
So Methylene Blue is actually a really old compound, a really old chemical compound that was originally discovered in the Industrial Revolution for its use in dyeing clothing. It's a dye. And then as time goes on, we start to use it more in microbiology and chemistry to dye certain pathogens in the laboratory to help us actually identify them, which is partially how it actually works in the human body. But fast forward to today, we primarily use it to promote mitochondrial function in the body. We hear a lot about the mitochondria being the powerhouse of the cell. It's what provides energy. It's what provides oxygen to the rest of the body. But if the mitochondria are not functioning well, then we don't function well. If they don't make energy, we walk around being low energy or low voltage. So Methylene Blue is a really unique compound that's available only at compounding pharmacies as far as getting the pharmaceutical grade or the safe grade for ingestion. And so this is baseline what we use it for, but it's been around for a really long time. We live in a really toxic world, a really toxic environment. You know, whether or not you're living in inner city Houston or you're living somewhere else, we're surrounded by a lot of toxins we cannot see. And so for that reason, a lot of people are good candidates for Methylene Blue because they can use that extra mitochondrial support. However, the people that come to us that really benefit from Methylene Blue the most, where it stands out the most in my eyes, are those that suffer from neurodegeneration. Because again, those mitochondria inside the cell, which are inside all the cells, live really densely in the central nervous system. So the brain, the spinal cord, throughout the legs. It's really important for helping send healthy nerve signals throughout the body. And when that process breaks down or doesn't function well, a lot of times it's a result of the mitochondria not working well. So when we think about ALS, Parkinson's, Alzheimer's, dementia, these neurodegenerative conditions that we refer to as progressive, nothing can reverse it. We just have to stop the progression. Methylene Blue is a really nice support for them to help them get their verbalization back, help to improve their mood, their attitude, how they communicate, how they fit in socially and interact with others. So it's really neat to see how these types of guests improve specifically. And then you've got the person who just really wants to optimize their health, right? They want to be strong. They want to be fit. They want to vibrate at a really high energy. They want to be mentally locked in and focused. Methylene Blue does something really interesting when you take it in oral capsule form, which is how we compound it, in that it really boots up your focus and how you lock in to an attention-related task. And that's primarily what I noticed when I took my first dose of Methylene Blue is I felt, wow, I didn't feel distracted. I just felt locked in to what I was trying to do.
And I take it too, so I know what you're talking about. So those are the people that don't have any symptoms and they just want that extra boost and that extra energy. But specifically, if someone had symptoms, what are those symptoms that they would be looking for to know that they were a good candidate?
Yeah, a couple things. I'd say the first one is a lack of focus, which we see that is increasingly becoming a problem. I think that could be a whole separate program on its own of why that happens. But at the end of the day, we have a lot of obligations in our life pulling us in different directions, a lot of distractions with social media, et cetera. And so when we get pulled in these different directions, we have a hard time and kind of erratic thinking. Now, Methylene Blue will help us to focus on that one task, to finish it, and then move on to the next. So it increases productivity to a certain extent. Also, those that have a history of some sort of neurodegeneration, like I referred to, the Parkinson's, the Alzheimer's, dementia, those type of symptoms to look out for: short-term memory loss, long-term memory loss, forgetting where you put your keys, this type of thing. Those are early onset signs that something potentially could be developing. Word recall is another big one. You have a very educated person, for example, who speaks fluently, speaks very well, and just has trouble kind of retrieving those words. That's an early sign as well that something could be going on. So Methylene Blue is very helpful for word retrieval as well, helps to manage mood. So those who are experiencing a lower mood, it can be helpful for them too, to kind of bring them back to their normal.
Okay. What about formulations?
So if you Google Methylene Blue, what you'll probably see is that, for one, it's used in injection in the hospital. And two, there's a lot of biohackers out there using it as an oral liquid. Now, the catch with the oral liquid is that it does temporarily stain your teeth, your gums, and your tongue a bright navy blue color.
Oh,
which is not what I want.
Exactly.
So I think that there's some sort of a visual representation there. Is they can see it's blue, so they think it's working type of thing. But we make ours in an oral capsule. So you're not going to have a blue tongue. You're not going to have a blue mouth. What you are going to have is bluish-greenish urine. And this is going to happen regardless of how you ingest the methylene blue. But what's interesting is that as it travels through your body, it actually is not blue. The stomach acid renders it a clear liquid. Because people will ask, well, are my insides going to turn blue? It's a dye. No, it's being used at a low dose. It's traveling through, doing its work within the body to address infections and inflammation and mitochondrial dysfunction. But when it's excreted, it's this nice bluish-greenish color.
Now, you compound methylene blue in Physician's Preference Pharmacy. Can someone get methylene blue off of the internet? And do you recommend that? And if not, why?
Yeah, that's a good question. It's a common one too, especially as there's more conversation opening up around methylene blue. So the oral liquid is available from online sources. And with any product that the pharmacy ever receives for compounding, any raw ingredients, we do always require a certificate of analysis, which we refer to as a C of A, which essentially is the specifications on that ingredient, allowing us to compound with confidence that is pharmaceutical grade. So if it does not come with a valid C of A and is not of pharmaceutical grade, we don't want to ingest it, which is why I only recommend getting your methylene blue compounded by a trusted compounding pharmacy.
So not all methylene blue is the same.
That's right.
Okay, so in that same vein, what are some important dosing considerations that surround methylene blue?
Yeah, so the dosing is going to be different if you're receiving it by IV, for example, in the hospital, or if you're taking it orally. Now, if you're taking it in oral liquid versus oral capsule, let's focus on the oral capsule form. It'd be the same, but essentially it's going to be weight-based dose. So we want to start at a low dose because methylene blue has a response in the body, which we refer to as a hormetic response. It means that it behaves differently when it's dosed low than when it's dosed high. So hear me when I say this, that more is not always better. People start to feel good on it and they want to go up in the dose, but that's not always recommended. So we start with a low weight-based dose, and then we still have some room to grow in the dose for symptom improvement if necessary. No need to titrate up, no need to start low and work up slowly. You just start with that low dose, you take it once a day, and it will start working for people very quickly.
Okay, sounds great. So if someone was interested in obtaining methylene blue from Physician's Preference Pharmacy, what would they do?
Well, they can call me at Physician's Preference Pharmacy, or any of our other pharmacists are available to take your questions. Again, we compound methylene blue right here on site, so I always recommend calling the pharmacy and understanding how the product is made, learning more from your pharmacists who are actually compounding the product about what's going into it, and the dosing guidance as well.
Okay. And they would need a prescription.
They do need a prescription for methylene blue. Anything that comes from the compounding pharmacy does require a prescription.
And can you help providers or doctors who are providers for patients to place an order?
Absolutely. Yeah. So if providers have questions, or if you're a patient and your provider is not familiar with how to dose methylene blue, they can also call up the pharmacy and ask to speak with any of our pharmacists, and we're happy to walk them through that.
Great.
Yeah.
Okay.
Yeah. So I hope that this has kind of provided some information and insight on what Methylene Blue can do for you. If you have any questions about this compound, and if you think that you might be experiencing symptoms that make Methylene Blue a good fit for you, then please feel free to reach out to us directly at the pharmacy, at Physician's Preference Pharmacy. The phone number is 281-828-9088, or you can visit our website at physicianspreferencerx.com. Thank you. At Physician's Preference Pharmacy, we understand that the quality of your compounded medications directly affects the way you feel, which is why we believe that your pharmacy should specialize in compounding medications while also delivering extraordinary hospitality and guest service. We believe that both patients and prescribers should accept nothing less than consistency and quality from their compounding pharmacy. This is why we've implemented some of the strictest quality standards in compounding, exceeding standard requirements, achieving PCAB accreditation, which is the Pharmacy Compounding Accreditation Board, an organization that sets the highest standards in compounding pharmacy regarding the safety, cleanliness, and quality of your compounded prescriptions. Because of our commitment to complete health and wellness, we are dedicated to making your medications free of lactose, parabens, artificial sweeteners, and any unnecessary dyes, binders, or fillers present in many other medications, offering you the cleanest products possible.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.